Hey, thanks for joining me. Be sure to like our page, subscribe, check us out on Facebook at Master Your Practice, and go to our website, masteryourpractice.com, for free resources. Remember to like and subscribe. Bye for now. Hi, I'm Dr. Charles Martin, and I'm hoping you're hearing me today, since yesterday it was a bit of a problem. So I'm hopeful that you're hearing me this day, and that if you are, put some type of comment over there in the sidebar so I know that you're there and that we can move ahead. So, today we're going to talk about the pandemic and the problems it's caused for you and how to handle them. And that tells me a little bit of a story. And the story is really about my wife. And my wife, bless her, has a problem with well, shall we call it bugs? We call it bugs. And her bug problem is that, well, let me just tell you the story. So I was going down to the basement, and in the basement there was a bug, and that bug was pretty little. But my wife kind of screamed and entreated me to come and get it. So I'm coming down the steps and I'm looking at it. And it doesn't look very big at all. But before I get there, it's hopped away. Well, she probably thought the bug looked like this. A quite different thing than what you or I might consider it. But it was a tiny bug, but it got away fast because it was so nimble. And nimbleness is what you need in your practice today because of what's going on. Your strategy must be the strategy of fast moving, fast decisions, adaptation. So, you know, the rule book that used to be, not unlike the rule book of the IRS, which is 2,500 pages, often with conflicting rules, today, that rule book is gone. The practice rule book is gone. And instead, we have a totally different situation where the rules are changing. You must adapt. And if you don't, you're going to be in trouble. We can, and I think you'll agree, say that the old normal, the one that you knew, is gone. And so today, it's the new normal. The new normal is the normal that you must be a part of and create. So, we don't know all the rules in the new normal. We don't know exactly what's going on. So, we have to work from principles, not rules like that RS manual. We have to work from guides. And those guides are what is going to be important for us to understand and to guide our situation. So, when we think about this, I want you to think in terms of what's happening, and let me do something here. Yeah, I'm going to get rid of this one and give you this one. So I'm hopeful that will be better for you. It's a little different camera. I have 3 cameras here, believe it or not. But the main point here is we must act from principles. And what are some of those principles? So these principles are going to be changing. Speaking of changing, it is my opinion that we're going to be more like this guy. Without shaking hands, more of hands up in the air as a signal of handshakes. We don't know that's going to be true, but I suspect it will be. So, understand that we have to understand the first principle, which is we have to practice safely. Why? Because for patients right now, their concerns are down here at basic needs like I want to live. The news cycle certainly has not helped related to what's happening in our community and around the world. Those flames have been fanned a long time. this is a prototype, can't even get it yet. But what's unique about this is that it provides a suction for that aerosol, a shield, and of course the face shields that you may employ now, one of the things the trouble is they get in the way of loops. So this is a better protection for both you and your chairside assistant than that, but it's not available yet. But the things that we're going to have, obviously, are masks. Getting N95 masks can be tough. We're going to have to wear disposable gowns. And as a quick sidebar, something might save you a little money. Think of this. Those gowns should be folded and available in the room. You should put a new one on when you're going to work on a patient. Then take it off and run it through the sterilizer when you're finished. This will enable you to keep your costs down when it comes to the cost of your PPE materials. We've done a good job in the past with gloves and wiping surfaces down. Still doing that, and still you should understand that we've got to have all the PPE stuff. Now, one of the questions that shows up quite often is the requirement for negative pressure rooms. What does that mean? It means that the airflow coming into your room is greater than going out of the room, such that the flow is from the hallway, either through an open door or under the door, and it's going up into an HVAC that is providing for you where a HEPA filter may be filtering the air and then exhausted. This is different. You may also, some of you may have ozone generators that you're using. Some may be using UVC light. Putting UVC lights in the air handler is something that can be done, and some of you will choose to do that. The thing I like about this particular system is that David Ahern has created this to exhaust that air out of the treatment room and away from patients. So this is something to keep in mind. Obviously, there are more guidances available to you from the ADA, the CDC, and OSHA, etc. So, a couple recommended resources for you. First on this is the one I've been talking to you about, that safety shield, David Ahern, and I will put these links down at the bottom of this video once it's finished, so you can go get this. But the second thing is the terrific job that Gordon and Rella Christensen have been doing for decades in dentistry on infection control. They have a significantly long and important free download white paper on infection control. You can see that right here. You probably can't read it, but that will also be down in the resources below when this is finished, so you don't have to worry about it. The one thing I would recommend to you, and I'm not being paid to say this, is that you get this video that Rella has, which I think will be a good guidance for you and your team when it comes to practicing dental care.